মেদুরও ঠিক আছে তো?
And a very good morning to Dr. Chaya. It gives me immense pleasure to be hosting the first webinar from the Department of Audiology and Speech Language Pathology in association with Department of Otorhinolaryngology, Yenepoya deemed to be university. I, Shweta Prabhu, and Mr. Hemraj Naik will be hosting this webinar, moderating the webinar. I welcome all of you to the webinar. I request Ms. Joylyn to deliver the welcome address.
When the whole world is silent, even one voice becomes powerful. We realize the importance of a voice when we are silenced. Dear attendees, on occasion of World Voice Day, I am pleased to welcome you to the guest talk on vocal fatigue, mechanism and prevention, organized by Department of Audiology and Speech Language Pathology in association with Department of ENT, Yenepoya Medical College Hospital. The World Voice Day is celebrated every year on April 16th. Established as a special day, World Voice Day is observed to create awareness, recognize, and celebrate the most important and at the same time often ignored gift of God, the human voice. Any person who uses voice for communication, including professional voice users, would have come across vocal fatigue or tiredness. Today's talk will help us understand the nature, mechanism, and prevention of vocal fatigue. It's my immense pleasure to introduce our esteemed speaker for the day, Dr. Chaya Nanjandeshwaran, Associate Professor, Department of Audiology and Speech Language Pathology, East Tennessee State University. She has completed a PhD from University of Pittsburgh. She has a CCC SLP certification and has more than 15 years of experience in the field of vocal rehabilitation. Dr. Chaya is specialized in the diagnosis and treatment of voice disorders, and her research interests include prevention and treatment of vocal fatigue and voice problems in professional voice users. She has over 15 peer-reviewed publications and more than 25 research projects completed. She has incredible track of receiving grants for research on voice. She is recipient of various travel awards, best paper awards, Dean's Research Fellowship Award, to name a few. Her professional contribution is remarkable. She has been invited as a resource person for various conferences and also served as a member in various committees. I welcome you, ma'am. I extend my deep felt gratitude for accepting our invitation for the guest talk on an important topic of vocal fatigue. Looking for many more associations and collaborations with you, ma'am. Thank you once again, and the platform is over to you, ma'am.
Thank you, Joylyn. You set the bar too high by providing such a detailed information about me, but I appreciate that. Good evening, everybody. Thank you for the organizing committee, Mr. Hemraj Naik, for having me as part of your speaker today on World Voice Day. This past year has been a very unusual year for all of us. With COVID, we've all been using masks, talking behind masks, teaching using a mask. So we've all experienced vocal fatigue at some point, even on these online platforms where we don't have to talk behind a mask, but we have to project a voice in a different way. So what a perfect way to celebrate World Voice Day, talking about vocal fatigue. This topic, as Joylyn introduced, when she introduced me, this is a topic that's near and dear to my heart. I have worked on vocal fatigue for the last 16 years. So I cannot summarize a lot of it in the 45 minutes that I have, but I'm going to try and highlight as much as I can on some of the things that we need to try to understand about vocal fatigue. So I will get into my presentation view now. Give me a second. I hate technology is a blessing and a curse. There we go. I think you should be able to see my screen. I will go into a slideshow. Okay, All right, so again, as we were introduced, we're going to talk a little bit about vocal fatigue. We're going to talk about measurement that will segue our way into mechanisms, and then we're going to talk a little bit about management of vocal fatigue. Love the World Voice Day theme this year. It's One World, Many Voices. What an apt theme. Okay, before we talk about vocal fatigue, I think Joylyn also introduced voice in a very beautiful way, saying we take voice, the human voice, for granted. So voice defines a person's identity. I jokingly tell my students all the time, when you are stranded on the highway and you don't have a cell phone, right now we all have this beautiful cell phone that we can talk. When I think about my college days, if I picked up a phone from a booth, which might be a new concept for many of you, and call my parents, they knew it was me because of my voice, right? So the voice defines a person's identity. When we also think about voice, we are making judgments about a person based on their voice. So if you're on the phone and somebody's really talking like this, you have a judgment about their voice on their phone because you're like, what kind of person this person is? What is their personality? So we are constantly judged based on our voice. And the interesting thing is, a lot of our occupations rely on our voice use. So as much as we take our voice for granted, voice is something that defines us. So with that kind of perspective in mind, this is going to be an overview of what I would like to cover. Again, as I said, this is a topic near and dear to my heart. 45 minutes is not sufficient, but I'm going to try to highlight as much as possible some of the key concepts. Okay. So when we talk about voice disorder, in general, about 3 to 9% of the population at any given point presents with a voice abnormality. Females, in general, have more vocal pathologies than males or experience more voice symptoms than males. And the prevalence of voice disorders is actually similar in children and adults. This can be an entire topic on its own because we see a lot of the adult population, at least in the United States. We very rarely see a lot of the child population or pediatric population for voice. So we won't even go there on some of the loopholes there are, but that's an entire topic on its own. We also talked about certain occupations presenting with more voice disorders, right? So we're going to touch on 3 voice disorders highlights today, which will be the teachers, singers, and us, the speech language pathologists. We rarely do think that we are professional voice users, but we truly indeed are. So when we talk a little bit about numbers in teachers, there's a large variation in the prevalence of voice disorders in teachers. Teachers are considered level 2 professional voice users. Anywhere ranging from 11% to 57% of the teachers experience a voice disorder at some point in their life. They also say that a voice disorder negatively impacts their teaching. I've also been recently involved in studies where I've looked at listener attitudes towards teachers with voice problems. And interestingly, our little kids, elementary school kids, have said they would not approach a teacher with a voice problem because they think the teacher is mean, the teacher is rude, is dumb. I mean, these are things that when I say elementary school kids, second grade and third grade children have rated their teacher to be more negative if they presented with a voice problem. Specifically, when we talk about vocal fatigue, 18 to 33% of teachers experience vocal fatigue at any given time. And again, we know that females have a more likely occurrence of voice issues compared to males. Our next population is singers. Singers are elite professional voice users. They are the level 1 type of voice users where their vocal demands are really high. But when you think about that, 46.9% of teachers experience a voice disorder at any given time. And the data reports that music teachers, which means teachers who are teaching singing and practice singing, they are at more risk than singers per se, because the teachers have to balance their speaking voice and their singing voice, and they have to use them both in tandem to be able to deliver the appropriate methodology of teaching to their students. Speech language pathologists, we are level 2 professional voice users, which means we're on the same tier as our teachers. 12% of speech language pathologists at any given time experience a voice disorder, out of which 71% perceive vocal fatigue. Okay. And when we looked at all of this, some of the highlights that keep coming across all these studies is not just the voice use. One is how we use our voice, but the other things like vocal hygiene habits, which is something that I will stress a lot more in management today, is there are contributing factors other than just the way we use our voice that may contribute to vocal fatigue. And that's something that we as speech language pathologists or even professional ENTs, we need to keep in mind that we may not see anything on the vocal folds that is causing their voice problem, but there is some contributing factors to the vocal folds, to our mental health, to our motivation, to our personality that may also cause the symptom of vocal fatigue. Okay, with that segue, talking about the importance of voice, knowing how prevalent voice disorders across our professional voice users, let's delve into this topic, which is why you all had me today, is about vocal fatigue. So, vocal fatigue is a debilitating condition and it affects an individual's occupational and social functioning. So, one of the things that we all know is we've all experienced vocal fatigue at some point, but it might be a transient impact that we may not take it seriously. But for a person who's experiencing vocal fatigue day in and day out and they want to start avoiding their voice use, then vocal fatigue becomes a serious issue. Given that this is a condition, there is extensive literature on vocal fatigue. So we will be focusing today on the definitions of vocal fatigue. I say definitions, yeah, it's not a definition. We're going to talk about how we have measured vocal fatigue all along, what are its pros and cons. Based on that, what are some of the broad mechanisms that we can think about vocal fatigue? And what are some things that we can do in order to either prevent or once it's there, how do we manage this condition? So when we talk about definitions of vocal fatigue, there are various definitions. When I first started my work in the field of vocal fatigue, I was confused on how do I recruit my participants? Which definition do I choose in order to recruit my participants for vocal fatigue? So the definitions that I came across, I've categorized them into a few different ways. One is vocal fatigue is being looked at from a very self-reported perspective. Like, what do I experience as a person? So my symptoms could be my voice is tired or my voice gets weaker the longer I talk. I experience effort or strain to produce my voice. My throat hurts or I have a discomfort in my throat, or I'm unable to have that good vocal control or even that range of flexibility. I have a reduced pitch range now. All of these were some of the self-reported work, and that is how we looked at vocal fatigue. On the other hand, another set of definitions looked at vocal fatigue as a physiological negative consequence of prolonged voice use. When I say that, I'm talking about a difference in fundamental frequency, lower fundamental frequency or a higher fundamental frequency, or changes in jitter and shimmer, or changes in PTP, which is phonation threshold pressure. Like, all of these are when somebody is going through a task, they measure before and after, and they're saying there is negative consequences with voice use. Then McCabe and Tidze, they started looking at it from an exercise physiology perspective, because let's not forget, before we looked into fatigue from our field, exercise physiology goes long ways ago. And all of my work has been based on the exercise physiology world. They indicated that vocal fatigue can be defined as an increase in phonatory effort accompanied by an decrease in phonatory capabilities. And then Nancy Solomon introduced that when there is such an increase in effort and decrease in capabilities, these may get better with rest. So think about the number of definitions that have been used to define one concept of vocal fatigue, right? So with all of these definitions, nothing stopped anybody from doing research. So we continued to do research, and this is what we did. We wanted to measure vocal fatigue. We wanted to see how can we identify what are the mechanisms of vocal fatigue. So when we talk about measurement, let's think about it in three different ways. Who were the participants that were recruited for the study? What kind of task was used to understand vocal fatigue? And what sort of outcome measures were utilized in order to understand vocal fatigue? Now, let's delve into each of these to get a better understanding of how measurement of vocal fatigue has been ongoing for the past 25 plus years. So typically our participants have included individuals with complaint of vocal fatigue. That makes sense, right? We're looking for understanding vocal fatigue. So we're going to recruit individuals who complain of vocal fatigue. But how do we know, or what definition do we take? So keep that in your mind as we go through this, is that which definition was used to understand individuals with complaint of vocal fatigue? Or they've typically taken vocally healthy individuals, meaning individuals who come to a clinic with no complaints, or vocally trained versus untrained participants, again, with or without complaints of vocal fatigue, and they are going to induce vocal fatigue in these individuals. So we have participants that have included individuals with or without complaints of vocal fatigue, and trained versus untrained participants. When we think about the task, this is a beautiful, if anybody wants to understand these tasks, Fujiki et al. Is a fantastic article, a beautiful systematic review summarizing what the tasks have been so far, that have been understood in the field to get an insight into vocal fatigue. So when we talk about a vocal loading task, hold on to this term because this term is going to change as we go through the presentation. A vocal loading task is when you put individual, when you're manipulating some of the parameters, which are intrinsic factors, extrinsic factors, and individual factors. When I say intrinsic factors, we are talking about how long did somebody talk, what was the duration of the task. It has varied anywhere from 3 minutes to 3 hours and 45 minutes. So you're almost thinking, wow, somebody can get fatigued in 3 minutes and somebody is taking 3 hours and 45 minutes to experience the symptoms of vocal fatigue. That itself should give us an indication that there is an individuality in the experience of vocal fatigue. Okay. So then the type of task, did they ask them to read louder? Did they ask them to change frequency? Did they ask them to do a singing task? So the type of the task also matters. And then did they also ask them to vary the vocal quality? Did somebody ask them to talk like this in a pressed voice? Did somebody ask them to talk like this in a breathy voice? Or if they asked them to talk in a regular speaking voice? So all of those were manipulations in terms of intrinsic factors. In terms of the extrinsic factors, it is the environment that you're changing. Did you do it in a lab setting? Did you do it in their classroom setting? What was the ambient noise level? What was the room acoustics? Did they vary the humidity? Can we have an external humidity that was too dry or a good humid situation? So those were extrinsic factors outside of a person's experience of their voice. And then the individual factors is the age, the sex, and the profession of the individual. Okay. So think about this. We're trying to understand one concept of vocal fatigue, and these are the multiple manipulations we are doing in a task to understand the concept of vocal fatigue. Outcome measures. Varied outcome measures have been chosen to understand vocal fatigue. So let's start off from our self-perceptual, meaning when the person is experiencing it, have they looked at their symptoms? Have they noticed any changes in symptoms? I put something called RPE here. It is called ratings of perceived exertion, meaning how effortful was it to produce your given task. Discomfort was another scale, vocal fatigue index as well. So we're looking at changes in the individual's perceived level of fatigue pre and post task. Auditory perceptualists, are we noticing any differences in the way their vocal quality sounds before and after the task? Sometimes these measurements have also been done during, like, if it's a 3-hour task, we do it before, we do it midway through the task, we do it, after the task. Acoustic measures. This has been a big chunk of our vocal fatigue literature, looking at fundamental frequency, intensity, noise to harmonic ratio. Now our beautiful new one is Kestrel peak prominence, CPP, jitter and shimmer. Those are just to name a few. I'm not giving us everything that's there. The standard deviation of fundamental frequency also goes in there. Then we have the aerodynamic, which is looking at the physiology, looking at phonation threshold pressure and airflow changes. Visual perceptual, put a scope down their throat or through their nose, and we're looking at any changes pre and post task on the vocal folds that may say that this is an indication of vocal fatigue. Then physiological changes, we're looking at EMG, putting little electrodes or hooked wire needles in your laryngeal muscles and seeing before and after a vocal loading task, are you observing changes in those muscle actions? My biggest line of research is that last part, which is oxygen uptake kinetics and recovery. I have individuals hooked to a mask that goes around their nose and mouth, and I ask them to read tasks with periods of rest. I'm measuring gas exchange. I'm looking at how much oxygen does one require to read and how long does it take for one to recover following the reading task. So that's been my chunk of work in addition to the VFI, the vocal fatigue index and the self-perceptual. That's been my biggest work in the field of vocal fatigue. And then there's respiratory. Do we think that fatigue, vocal fatigue, is more related to this area? Or is it a subsystem that can be respiratory, phonatory, and articulatory? And so there's been some chunk of work done in the respiratory world to look at pulmonary function and lung volume with very minimal variations. If we look across this broad range of outcome measures, there's been no consistent outcome measure saying if somebody experiences vocal fatigue, this is what we are going to see. So, why do we have so many outcome measures but very minimal correlation or very minimal consistency in these outcome measures? So, some of the gaps lie right here. It goes back to who were our participants, and there is an individual variation. Not everybody experiences fatigue the same way as another person. Not everybody reaches that fatigue. For example, if I take 10 people from this group and say, let's go on a treadmill, each of us is going to experience that physical fatigue at a different level because it depends on our body's conditioning to exercise. The same thing, there is a certain vocal conditioning that everybody has. And so by choosing a heterogeneous population and trying to all have go through the same task, we are not controlling for that vocal conditioning or the vocal capabilities of that person. Again, what definition did we use and how were the individuals recruited? The task has been so varied, reading anywhere from 3 minutes to 3 hours 45 minutes, choosing a prolonged reading task, choosing a loud reading task. So all of these variability in tasks, what is it that we are really trying to capture? Are we looking at the effects of these tasks? Are we looking at the underlying mechanism of vocal fatigue? So that's like the really big question. I'm introducing a new term that you have not heard here so far. Is it a vocal demand response or is it an indication of vocal fatigue? So in order to understand that concept, I have to define what a vocal demand is, okay, and what a vocal demand response is. A vocal demand is a vocal requirement for a communication scenario. For example, my vocal demand right now for this vocal communication scenario is I am talking to a screen where I don't see anybody. Okay, I don't see your expressions, I don't even see myself, I just have my slides. So I'm actually speaking to a computer not knowing if you are understanding what I'm saying. So I have a stress level that I have to implement in order to get through this communication scenario, right? So that is my vocal demand. My vocal demand response is my changes in the physiological system of how I'm changing my vocal folds to respond to that communication scenario. Am I changing my pitch? Am I changing my loudness? So right now I know I am changing my stress levels, which means I'm adding more duration and more intensity on certain sounds to be able to meet those demands. So that is the vocal demand response. So when we do a vocal loading task, which actually now becomes the vocal demand, it's no longer called the vocal loading task because we have redefined this as a vocal demand. That is the communication scenario. So reading loud, prolonged reading task, all of that becomes the vocal demand. That's your communication scenario. When you are capturing this, you are getting a vocal demand response. How is each individual responding to that demand scenario? So, are my outcome measures capturing the adjustments to the vocal demand, so which is the vocal demand response, or is that an indication of vocal fatigue? So, really, we need to take a step and say, all of the work that we have done so far, are we truly capturing outcome measures that are actually an indication of vocal fatigue and not a vocal demand response? Okay. So, with all of this, Hunter et al. 2020 paper, I was part of that paper. We were 8 individuals on that, really trying to think about what can we do to better define all of this vocal load, vocal loading, vocal effort, vocal fatigue. So we redefined all of these terms. And the way vocal fatigue was redefined is it's called a quantifiable decline in function, meaning I can measure that there is a change in function. The change in function is twofold. One is it's in terms of performance, meaning I'm not able to maintain a certain duration of task or a certain loudness of the task. So I'm measuring the performance decline. I'm also measuring the perception decline, meaning how do I perceive my ability to maintain that task. Within that, we have twofold prong. One is the trait perception, and one is a state perception. Trait meaning I'm experiencing these symptoms over a long period of time. Okay. State perception meaning if you asked me, what is your vocal fatigue at this point during this task that I'm trying to talk over the computer to a blank screen, that'll be state. Trait is in the last month, how have you experienced these symptoms? So it's very important to kind of really think about those two things. The reason being, if I have a person who's been experiencing vocal fatigue for the last month, right, and they come in, they're going to have that underlying fatigue at all points. They have not recovered. While a person who comes in with no fatigue will have different experiences on the state fatigue. Okay, and that's why I say it is very individual specific. We really wanted to indicate that vocal fatigue is very heterogeneous, meaning it is not experienced the same way, like pain. Of the 10, 15 people that are there around me and you, we all experience pain, or our tolerance to pain is different. And pain is perception, right? We perceive it. Similarly, vocal fatigue can also be a perceived phenomenon that is very individual specific. For example, if I didn't sleep well last night, maybe my ability to have this conversation or this presentation and the fatigue levels may be different, but if I have got a good amount of sleep. So there are a lot of factors, we will talk about those, called modulating factors, that will influence one's experience of fatigue as well. Okay, so that was a lot. I try to kind of give you a brief overview saying where we are, but when we start measuring vocal fatigue, we really have to have some considerations. This again is drawn from the exercise physiology literature by Enoka and Duchu in 2016. I should have put that on my slides. I apologize for not putting the reference, but they wanted to define the difference between fatigue and fatigability. Fatigue is the experience of it, the symptom. Fatigability is the rate of decline in your performance and your perception, which is a consequence of the symptom. So when we are looking at measurement, we want to really split these two and say, am I measuring fatigue as a symptom, or am I measuring the decline in the performance and the decline in the perception, which is now newly labeled as fatigability? Okay. So let's talk about and see, what do we know when we look at fatigability in terms of perception and performance. So perceived fatigability, again, I said those are two different things to go, the state and the trait. The state fatigue is for the task in question. So for example, for my research protocol, where my participants have this little mask that goes around their nose and mouth, they're talking for 5 minutes at a conversational volume, and then they talk for 5 minutes at a loud volume, and they have periods of rest in between. For each task, I'm asking them, what was the level of perceived exertion to complete that task? And I'll show you what I use, the Borg CR10, in just a minute. And the trait fatigue is when they come in, I'm asking them, over a period of time, where do you see yourself, or what is your experience of these symptoms, for which we use the vocal fatigue index. In my research protocol, I also use a global rating of vocal fatigue, where I ask them from 0 to 100 on a visual analog scale. I'm asking them where they feel their global rating of fatigue is. Okay, so there are different ways, but these are the two main things we need to understand when we talk about fatigue. If you're using for a task, we're asking them during that time, and then we want to know what they came with. So this is the Borg CR10 developed by Baldner and Van Mersbergen, where they used, so Borg Scale has been used significantly in the exercise physiology world again. Okay, so exercise, the Borg is the individual who developed the scale. That's why it's called the Borg Scale. There have been various versions of it, and this one is particularly adapted for the voice world. So very, very slight vocal effort, or just noticeable vocal effort, is 0.5. It goes in increments to maximum vocal effort, that's at 10. So this is something that I use with my research protocol to say, what is your effort for each given task? Okay, that's your state fatigue. Then the vocal fatigue index, I spent but 7 years of my life developing this. It's very near and dear to my heart. There's a lot more work that's going on in this. By no means this is a perfect index, but this is something that came along when we were having difficulty defining vocal fatigue. So we took a very self-reported symptoms approach, and we came along with this index. Again, as I said, this is a very rudimentary. We're doing a lot of work on this now, but we definitely use the vocal fatigue index to talk about trait fatigue. Given a period of time, what is your experience of these symptoms? Okay, so if you look at these, we're talking about the first factor up here, the part one, talks a little bit about their tiredness of voice. I don't feel, my voice feels tired. It feels like work to use my voice. It's effortful to produce my voice. I find it difficult to project my voice. So those are like tiredness related stuff. And then we have avoidance. So that's a factor. And then we have discomfort, physical pain and discomfort, which is part two. And then this one really integrated the rest concept, like what happens to my voice that gets better. I know that this is getting validated in multiple languages. I know one that's published in the Indian language is Tamil, which has 4 factors instead of 3 factors. Okay, but this is what defines the trait fatigue. So when we talk about perception, we want to make sure we're measuring state and trait fatigue. When we talk about performance fatigability, this is where we really need to go back and do a lot more work, because we really have to capture a decline in performance ability. That is, how are we saying that there is a decreased power, or there is an increased time to complete a task, or a decreased force production? This is what is done in the exercise physiology world. When we think about the exercise physiology world, they'll make you run on a treadmill. They're looking at the force production when you start and the force production when you end. And they're looking at maximum oxygen uptake during these tasks. So what is a parallel to talk about fatigability in terms of performance for voice? We really need to identify that. Again, we need to be aware of that vocal demand response. We don't want to capture the adjustments to the system to meet the vocal demand, but we really want to capture the underlying mechanism of vocal fatigue. Okay, so when we consider any measurement, we really need to take into account these modulating factors, meaning individual specific factors that need to be identified and utilized in our methodology when we understand vocal fatigue, especially when it comes to perception. You know, the mood. If a person comes with a lousy mood to our experimental protocol, they're not going to feel as good to give us our research measures, right? Personality, an introverted personality versus an extroverted personality. Pain, our tolerance to pain. Expectations from what, as a researcher or a clinic, what are we doing? Performance feedback. All of these is going to affect how a person is going to perceive their decline in perception of fatigue. And then the performance is, are we capturing a neuromuscular issue of fatigue? Are we capturing a tissue-related fatigue? Are we capturing a metabolic-related fatigue? So we really need to take into considerations because for each of those modulating factors, your outcome measure is going to be different. So I cannot take neuromuscular fatigue and use PTP. Tissue fatigue might be better with PTP. So what is it that we are trying to capture? What mechanism is it we're trying to achieve is how we need to think about our outcome measures. So having said all of that, that was a lot of information in a very brief period of time. When we talk about vocal fatigue, we're looking at neuromuscular inefficiency issues. Are we using too much muscle work? Are we using laryngeal tissue that is affecting the way the vocal folds vibrate? Are we using an anaerobic way or an aerobic way to manage our talking? Because when we think about any physical activity, there is certain resources in our muscle, right? If I'm a sprinter, which I was a long time ago, I'm going to rely on my immediate resources in the muscle to be able to run that 50 meters or 100 meters run, right? My oxygen is not going to kick in right away. But if I'm going to be a marathon runner, I will start off with my anaerobic, and then I use my oxygen, and then the finish line, I'm going to go back and rely on my anaerobic to get that speed, right? So really we need to take a step back and think, is our voice mechanism when we talk, is it anaerobic or is it aerobic? And do we really need to think about how do we manage oxygen? Again, all of these mechanisms that we talk about are definitely modulated by an individual's vocal fold biochemistry, that is the makeup of their vocal folds, and an individual's tolerance levels. What is their tolerance for vocal fatigue? Okay. Okay, so let me take a quick sip of water because I can feel my throat getting dry. So to summarize, I know I gave in from a lot of research perspective, right? So what do we do? Clinically, what am I supposed to look for when a patient presents with vocal fatigue? Now, let's think about this for a second. I'm only talking, every information that I've given so far is on an individual that is not experiencing vocal fatigue secondary to an underlying pathology. So I am not talking about those individuals that have paralysis, atrophy of the vocal folds, lesions of the vocal folds. I am not talking about those individuals that have an underlying pathology and experiencing vocal fatigue as a symptom of it or as a consequence of it. The entire work that I've presented to you so far is on that individual who visually we may not see anything on their vocal folds like a major pathology, but it's still complaining of vocal fatigue. And we are not supposed to just say, you can get over it. We really need to do something about these individuals. So we want to look at it in our clinic from a perceived fatigability standpoint because not every place has the opportunity to do a lot of these measurements. So we look at it from a set of symptoms. I think that's the best way to look at it is, are they complaining of tiredness of their voice? Are they complaining of effort to produce their voice? Are they complaining that their voice gets weaker the longer they talk, or their voice gets raspy the longer they talk? Are we talking about decreased projection of their voice, sore throat sensation, any physical discomfort? All of these relate to the symptom of having that perceived fatigability with voice use. Okay. Sometimes on visual examination, you may see edema of the vocal folds, a change in the amplitude of vocal fold vibration, and possibly a glottal closure issue. And more so, what we have seen is an anterior chink that is not explained by any other underlying vocal pathology. A lot of the times, my patients that I see have acid reflux issues, and acid reflux can result because think about it, if you put a little bit of acid on your hand and it starts to burn, that same thing on our mucosa is going to irritate and cause edema on the vocal fold, swelling and inflammation, which means you need to use a different vibratory pattern to get your vocal folds to move. And so we may lose the efficiency at that point, again, resulting in the perception of vocal fatigue, which is what the client presents with or the patient presents with as a symptom. Okay, fatigue as a symptom. So clinically, we really need to take it from a perception standpoint because the the patient can tell you that this doesn't feel right, and then it is our job to be able to say, can we identify visually something on your vocal folds that indicates why this doesn't feel right, or what else can we do? Especially if it's a professional voice user, it becomes our primary role to help these individuals to work through the symptom. Okay, so let's segue into prevention and management. In the US, this report I've given you is in the US. Teachers make up 4% of our population, but make 20% of the SLP caseload. And singers are 0.02% of the population, that they make about 11.5% of the SLP caseload. The one thing we don't have data on are speech language pathologists. What is the percent of the population? What percent of that make our own caseload, right? But these are professional voice users, and these individuals really are experiencing difficulties with their voice. Prevention is obviously the best way. If we can increase awareness, that becomes our role as speech language pathologists as well, is to increase awareness of the importance of voice, especially in their occupation, to avoid any negative consequences on their voice, right? One of the highlights that I really like is vocal hygiene. We're really thinking about what are some things that we can do, and I'll go into detail about what entails vocal hygiene. We want to really also give them the knowledge that when something doesn't feel right, rest your voice or plan vocal naps throughout the day. I really like to do this with my teachers, especially when I say, if you can introduce 2 to 3 minutes of silence in your voice during the day, inbuilt it in your build it in your curriculum, so where the students are doing a group work and you can just rest your voice, it's very helpful. And one of the key things we want to talk about is healthy vocal patterns. Habilitation, meaning, why do we always have to work on rehab? If you think about the exercise physiology world, an athlete, we are vocal athletes, every single professional voice user, is a vocal athlete, our athletes are trained to use their system on a regular basis, right? They don't wait for rehab. They do get rehab if they injure themselves, but there is constant training going on. So, what do we do in terms of voice to train? Really, not much, especially for our teachers. We're vocal athletes. So, what is it that we're doing? So, um, sorry, I didn't mean to jump there. So, we really need to think about habilitation. I'll spend a little bit more time on it. But if you think about it, um, we have to warm up our voice. Okay. I don't know how many of you play an instrument, but if you do, I always bring this example in my class and to my patients. We don't go and play an instrument like a guitar or a veena or a tanpura, anything, any of the instruments that you do without tuning the instrument. Otherwise, your pitch of the instrument is going to be off. We tune the instrument before we play the instrument. Our voice, our vocal folds are also an instrument. So why are we not training our instrument to be, or warming up our instrument to be able to get the best possible output? Okay, so, and we'll talk about what can we do in just a few minutes. So let's spend a little bit time. When I said vocal hygiene, it's not a list of do's or don'ts. Okay, you don't want to give them this huge list, say don't eat spicy food, don't eat chocolate, don't drink milk, don't have dairy products. When you give, avoid onions, avoid garlic, you can relate to me here. People can. When I'll say I'm from India, right? I grew up in India. I still eat Indian food. I love my curry with onions and tomatoes and garlic and ginger. That is going to cause acid reflux. So instead of giving them a list of do's or don'ts, you really want to emphasize that certain foods may cause more acid reflux than others. I don't know, how do I say, I know this is in Tamil. I don't know how many of you understand. This is called Vatta Kurumbu, which is a really tangy, or puligoje, or, gotsu, however you want to call it, everything with tamarind. That's my most favorite food. But I know the moment I eat it, I have mucus sitting on my vocal folds, right? So we have to really bring it to our attention to our patients is that there are certain foods that may trigger this. So maybe avoiding that before your periods of long voice use. Hydration. Water is very, very important. Yes, there is a lot of literature out there that says mixed information that hydration, when they've done studies, when they've dehydrated the vocal fold or changed the surface humidity, like when there's mouth breathing, that there is not much change, but it does impact your ability to produce voicing. So hydration is something that's important. Coffee, caffeine. We drink a lot of coffee and tea in India. They're all caffeinated. Sometimes, yes, there is decaf now, and we're very conscious of it, of drinking decaf. But if we don't, we're drinking caffeine. Caffeine is a diuretic, which means we're getting water out of the system. So really balancing that water intake and the caffeine is important. Acid reflux management is very, very important. Simple behavioral strategies can help. We really don't have to rely on medication all the time. Allergies. Here, people have a lot of allergies. In fact, my son currently sneezes about 100 times a day with the pollen that's coming in the area now with the bloom season we have in spring. But in India, we have pollution, dust allergy, smoke allergies. So there is a lot of those irritants. Smoking, all of this is going to go and cause inflammation on your vocal folds. So those are things that we may not think, oh, this is our general everyday living, so get used to it. No, that get used to it is impacting somebody's vocal capabilities. So that's something that we really need to keep in mind and educate our clients. Prevention of phonotraumatic behaviors, constantly clearing your throat, constantly yelling, talking over background noise. These are things that are causing trauma to our vocal folds. And so usually for my patients, if they are professional voice users, especially my singers, you will give them alternate strategies to clear their throat. So some of the strategies that I usually give my clients are do a dry cough and swallow. So you're really not giving a hard cough. Take a sip of water, do a hard swallow. And the fourth one I really like, which is what I do, is I do this and swallow. This particular exercise is actually two birds in one stone, or killing two birds in one stone, kind of that. I mean, it's easy for me to get Tamil. I know most of you are not Tamil, but it's that concept saying, I'm also getting my vocal folds to vibrate nice and easy. I'm also getting rid of the mucus in my throat. So it's accomplishing two things in one task. So I really love that exercise, and I'll walk you through that exercise when we go over vocal exercises. When we talk about background noise, you can plug your ears and go 1, 2, 3, 4, 5, enhancing the bone conduction. So usually I'll tell my singers who like to go to parties after their concert to use a little earplug and talk so that they're really not using a voice that is loud. Okay. And then we talk with our teachers, we talk a little bit about amplification and projecting their voice using a portable amplifier instead of trying to just get loud, especially if you have a lot of background noise. Sometimes in our classroom, if it's too hot, we raise our windows, and so there is noise coming out from the outside world. So using amplification is going to be helpful as well. With singers, one of the key things that I really want to make them aware is that your speaking voice and singing voice use the exact same instrument, which means I sing with this beautiful technique, happy birthday to you, happy birthday to you. I have this beautiful technique when I sing. And then when I talk like this. I'm using, a glottal fry in my speaking voice. The glottal fry is very predominant here in the United States. I don't see that as much, or I don't hear that as much in India, but, people really talk with this kind of a voice. So you have to make them aware that you're using the same vocal folds to speak and sing. So be aware that you can speak in a way that you don't care about your voice, and then you sing at this beautiful technique. At some point, it's going to catch up, right? At some point, the way you speak is going to impact your singing voice as well. Again, we're talking about, habilitation versus rehabilitation. I really talked more so about that, tune your instruments. So, we all know about warm up, right? Meaning you get your system to get to the level to produce. So a lot of the times we want to warm up by using musical scales. So sa re ga ma pa da ni sa. And then, our classical singers will go through their entire ragas in the notes to warm up their voice. But how many of us cool down? Cool down meaning you can use the same exercises. You just gave a 3-hour concert, and then you go, your vocal flexibility and range is kind of really at that high intense level, and then we go into that talking with that high intense level. So using some of the warm-ups, even a couple of minutes, when we do exercise, right, when we are training, we do a warm-up, we do the actual protocol, and we do a cool down and finish the exercise. So the same thing needs to happen for voice. You warm up, you perform, you cool down, and you finish. The cool down is just as simple as doing some of the scales, or even going anything like that that's going to bring you back down into easing into your speaking voice. Okay, so those are some things that we need to have a regimen to train our voice. Even non-singers, teachers, and SLPs, you can spend 5 minutes doing some of these vocal exercises before you start your day, and you can end with these at the end of the day so that you are giving your vocal folds a chance to repair and recover from the extensive voice use we do. So these warm-ups and cool downs, this habilitation is not only for singers, this is for professional voice users. And it becomes very important to educate our teachers to say, your voice is important. You don't have a job without your voice. Same goes for speech language pathology. Our voice is our job. We don't have a job without our voice, okay? So when we talk about vocal exercises, our main job is to have an optimal vocal efficiency and vocal economy, meaning we have to have a good output to cost ratio. We want a good vocal quality, right, with minimal effort to produce our voice. So we want to optimize that demand response. We want to optimize that effort. So right now, if I'm talking like this, right now, I'm really trying to project my voice from here. This is going to increase my vocal effort at the end. By the time I'm done with this 1-hour talk, I'm going to be tired. But if I can think about where my voice is coming from, I'm really projecting my voice right now from my mouth. I'm using my resonance to increase my volume. That is going to optimize my economy and efficiency, avoiding the poor vocal demand response and increasing my effort to produce my voice. Starting early is key. When I teach my students, we're doing vocal exercises every class so that they get into the habit of really thinking about how to use their voice. They may not be where I need them to be, but knowing that it works, knowing that it helps, will also make them get the buy-in and to implement these on a day-to-day basis. Okay. So some of the exercises that I typically will do with my professional voice users, singers, teachers, are SOVT, which are semi-occluded vocal tract exercises. Basically, the idea of these exercises is, there's a whole rationale for this. I didn't put all of this there because we don't have as much time to go into the details of this, but it offers a massage-like sensation and it changes the way you produce your voice, again, modifying that vocal demand response, making it more efficient and economical. It decreases your muscle effort and throat discomfort. And these are some of the exercises where basically you blow bubbles with or without resistance. I'm going to demonstrate that in a minute. Or you trill away, which is. And the resonant voice therapy is a good acoustic output with least effort with barely adducted, abducted vocal folds. Your vocal folds are barely touching each other, and SOFT exercises increase the vocal fold oscillation. Okay, so these are exercises that can be done anywhere, and this can serve as vocal warm-up exercises, and so you can use these exercises at any time to improve your economy, decrease your muscle effort, and decrease any kind of fatigue sensation that you might have. Okay. The other things to think about is, again, my work in this area of vocal fatigue is to see if you put people on a treadmill. Yes, you heard me right. I'm putting individuals with complaints of vocal fatigue on a treadmill and I'm getting them to exercise to see if we can have better supply of oxygen and blood supply to the working muscles in your throat and better recovery process. So it may not be a bad idea to get our individuals to exercise to help the management of vocal fatigue. And again, we need to think about sleep, stress, their personality. All of these comes into picture. So if I'm a very introverted personality and I'm kind of like talking like this, I'm really a very quiet person and I might be holding my breath while I'm talking. So you can still be a quiet person, but you can use airflow in your speaking voice like this. So you can work on these things, and we really need to educate our clients on all of these influencing factors, including their stress levels, their sleep levels, their sedentary nature, not exercising, not tuning their vocal instrument to adequately meet the demands of their voice, or even to take care of those contributing factors like, I have constant nose drainage, sinus issues. That is also going to impact their voice. Constant acid reflux. All of these are things that we need to think. It's like an eclectic approach. You think about this broad framework and you try to use this for each individual to see what fits best in order to produce the voice. Okay. So with that, I'm going to demonstrate. I don't know. I think we have 4 minutes left. Maybe I need to open it up for discussion. Organizing committee, what would you like me to do?
Ma'am, there's one question in the chat box uh,
Yes.
by Geeta Sridhar. She has asked, were the persons tested allowed to hydrate during the testing and was it controlled?
Yes, a lot of the studies have had controlled hydration testing. So they've had different groups where one group will get a continuous hydration and then a control group with no hydration. Yes, but all of the studies pretty much have been done in a lab setting.
Okay. I think now we can move on with the demonstration.
Okay. All right.
And
Thank you. Yeah, go ahead.
okay.
Okay. So with this, I indicated that some of these exercises are very simple to do, access to a straw or just your lips. You want to be able to use your lips to be able to make that good sound from semi-occluded. So you can go on a sustained phonation. You can go up and down in pitch. You can even hum a tune. So you can practice any of your exercises. If singers, they can practice any song through a lip trill like this or through a straw, which I'll demonstrate in a second, is to be able to feel that nice vibrations, anterior vibrations, The key, as the last statement there, it says, the key is the sensation. You want to feel the buzzing or the anterior vibrations. The same thing is with straw exercises. I do it with resistance. So I have a little bit of water in my cup. So I place the straw halfway through the water and I go. You want to feel vibrations or buzzing in the front of your lips. You want to feel consistent, or you want to hear consistent bubbles. Again, Dr. Marco Guzman says that it really increases the oscillation in the mouth as well, the pressure oscillation inside your mouth, in the pharyngeal area, in the laryngeal area, giving it a massage-like sensation when you use the water. And then you can go. I don't know if you can hear my bubbles, but if you heard my bubbles stay consistent when I increase the pitch or decrease the pitch. You really don't want the bubbles to sound like this. You don't want that. That means you're using too much pressure to regulate your pitch. Okay. Then you can do the happy birthday song again. So you can practice any song through this, and this is something that you can do throughout the day. Ingo Tidza has a beautiful video on. He uses a coffee stirrer straw that's really small in dimension. You can use it too and go. Again, you want to feel, and I can see here all my paper there was moving with the air. So you really need to feel the airflow. You really need the buzzing. You see, I'm kind of itchy because I'm feeling a lot of buzzing through that. So you can just walk with a straw, and you really don't need water because sometimes we don't have access to that. But these are simple exercises that you can do throughout the day. You all you have to do is practice them for about 2 to 3 minutes. Before you do a talk like this, and then you finish the talk and you're going to do, I'm certainly going to be blowing some bubbles after I'm done with this talk. But these are some things that you can do to ease your voice and kind of really prevent it from getting any phonotrauma. Okay, so I'm going to end with this. Given that India is going through a lot of new cases, which means mask is going to be there for a long time. I wear a mask all the time. I teach a class of 39 with my mask on when I teach them in person. But these are some pandemic related tips for mask use. You want to choose the right type of mask. I don't like my cloth mask as much. I do like this mask. It gives me a little bit more volume, or the ability to move my jaws and articulators. That's the most important thing. You don't want to talk like this with your mask on, because then you're not getting a lot of that articulator movement. You want to exaggerate your articulation when you talk, because that is going to increase your volume behind the mask. You want to speak slower and pause as you talk. You don't want to talk like this and kind of run like this and go lower in volume. That means the person is not going to be able to hear you. You want to project your voice from your mouth and diaphragm instead of your throat. So there is a difference between the two. Again, we talked about vocal naps, drink water. I usually get my attention of my students by banging on the table or using a bell. So use other means to communicate, especially I'm talking about for teachers who are using their voice in a large classroom. If you have access to your microphone, please use a portable amplifier. The biggest thing is listen to your voice. Don't let it slide by and say, I've been using my voice for 7 hours. I've been talking for 5 days. It'll get better. No, it doesn't. Especially if it's going on for longer than 2 weeks, there's something that you need to really address and take care of your voice. Okay. With that, thank you so much for giving me the opportunity to talk about this very important topic, and I hope I've been able to give you some takeaways that you can take with you on the concept of vocal fatigue.
It's open for discussion. Any questions? I have a question in the chat box. How to overcome an inflammation of the voice box from overuse due to nature of work, continuous meeting? If ignored, can that lead to cancer or chronic, and is it reversible?
Okay, so so we're talking about phonotrauma. So yes, your job requires you to use your voice, and it's going to impact. It can cause inflammation. Chronic inflammation can result in a pathology that can arise, not necessarily cancer, but we're talking about vocal fold lesions. So there is a potential for that. Now, cancer can occur if you're also using smoking, alcohol, and all of those risk factors that are associated with it. So yes, those can be prevented by using those simple strategies of your voice. So if we're speaking for 7 hours during a day, use some of these exercises. Rest your voice as much as you can, because when we keep talking, we're going to keep adding that inflammation. During these times, we want to use exercises that are going to minimize the contact between the vocal folds. The resonant voice or the SOVT exercises will do that. So even thinking about your voice and practicing these exercises once or twice a day is going to help with those symptoms that you're experiencing from those increased demands in your work environment.
Okay, thank you. There's a next question. Why does cardiovascular exercise help in vocal fatigue? Uh, as in, is there any idea about the mechanism? If yes, what is the mechanism?
Okay. So again, I'm going to try to summarize this in like 2 minutes, because this is my 8 years worth of work that was beautifully asked in one question. So when we did a study, we identified that individuals with vocal fatigue were relying more on muscle resources and not using oxygen to meet the demands of the vocal task. We had a control group, which was a cardiovascular group, who were vocally healthy. And when you observe them use their voice, they were using oxygen to meet the demands of the task. So then we started to think that, are we relying more on aerobic versus anaerobic mechanism to produce our voice? And if we need to rely on aerobic mechanism, we need to be able to use more oxygen. So by using cardiovascular conditioning, our job is to increase the ability of the body to use oxygen to pump blood and take the oxygen to those working muscles in the larynx, and the recovery, meaning, how long does it take after we used your muscle resources? You have to pay back those muscle resources. You use oxygen again to pay back those muscle resources. So cardiovascular conditioning is acting twofold. It's taking oxygen to the muscles during the task. The cardiovascular conditioning is also pumping back oxygen after you've used the task to replenish your muscle resources. So overall, we're just increasing the conditioning of the body to meet the demands of the task. Yeah, that was a very quick answer. That can be an entire hour discussion. But yes, so that is why we're using cardiovascular conditioning. Right now, I do have a grant that is looking at voice therapy versus cardiovascular conditioning in the management of vocal fatigue. So stay tuned for more information.
Okay. The next one is, what is the influence of temperature of water in reducing vocal fatigue?
That's a great question. I don't know if I have a scientific answer for that. Whether warm water versus cold water, I think it's very individual specific, is what I would say. Some people like the taste of cold water. Some people like the taste of warm water. Some people say warm water is very soothing to the back of the throat. But I don't know if there is any scientific information in the literature that has measured the temperature of the water to say, is one better on the other. I'm a warm water person. This keeps my water warm. I love it. It's just because it's soothing to me. On the other hand, for my chronic cough patients, I do work with chronic cough who constantly cough. Cold water is really good because it changes the sensitivity and the sensation to the brain, so they may stop coughing. So it is very individual specific.
Okay. Does vocal demand lead to vocal fatigue? If so, do you have any standards to tell after how many hours or time vocal fatigueness initiates?
Okay. So that's a $1 million question that we've been trying to tease out, right?
Yes.
So the vocal demand response, I think everything that we have talked so far is that vocal demand response. Like if we talk for long periods of time, we are going to have a change in the way we are producing our voicing. Is that truly Fatigue or not, that is something that I think we really need to take a step back and go into that slide where I talked about the modulating factors and choose the right outcome measure to say that we are actually capturing fatigue and not the demand response. One other thing that I want to say is each individual is different. So we have individual specificity. So I can talk for 3 hours and may not experience vocal fatigue as the same amount of loudness and the same communication scenario compared to Joylyn, who maybe experiences vocal fatigue. I just picked your name, Joylyn. Don't get scared. To just experience fatigue. So again, that individual factor becomes modulating factors becomes very important. So there are studies that are now looking at what kind of task is good. In fact, Supraja Anand recently came up with a new vocal loading task where it's a short duration, but you alternate the task. You go higher in pitch, you go lower in pitch, then you do a phonation task. So, there's a lot of studies, but we don't have one answer to say this is the right task to induce fatigue. And do we really want to induce fatigue, or do we really want to understand the mechanism of fatigue? I think that's where we have to draw the line.
Any more questions? Okay. I don't see any further questions in the chat box, ma'am. So I would like to, on behalf of Department of Audiology and Speech Language Pathology and Department of ENT, I take this opportunity and privilege to thank our esteemed speaker of the day, Dr. Chaya Ninjundeshwaran. We have been fortunate, ma'am, to have you here. You have an excellent experience in academic, clinical, and research areas of voice, and it was a very enlightening session. And there are a lot of thank you coming in the chat box too for an enlightening session. Vocal fatigue is one area which we have not, it's not paid much attention to. So your talk has made us really think about it again. And there's a lot more to understand and work in terms of evaluation, intervention, and research in the area. I thank you once again, Dr. Chaya. I extend my thank you, ma'am.
Thank you. I appreciate your invitation to talk. I had fun talking about it, and thank you for everybody who has said this was a good talk and they benefited from it. And you can share my email across participants if they have any questions. I'll be more than happy to answer them via email as well.
Sure, ma'am. We will do that. I extend my gratitude to the organizing team, IT department, dean, and the management of Yenepoya University for their constant support and guidance. I'm very thankful to the entire participants who have made the session very good. And I'm sure we'll continue to conduct more webinars and help in the professional growth of our field. Thank you, one and all.
Ma'am, would you put your email ID in this chat?
Yes, sure.
And just one question: how do one realize that the voice has been overused? I mean, is there any symptoms?
So I'm not a believer of the term overuse, misuse, or abuse.
Okay.
I was trained by my advisor to take those concepts out of my head, because once we talk about overuse, misuse, or abuse, it's from a patient perspective that we are putting the blame on them. So we're telling them, hey, you're using your voice, you're overusing your voice. Once you put the blame on them, it's very hard to get their buy-in in therapy. So we call them phonotrauma. It can be varied. You can have inflammation, increased vascularity. Sometimes, you go to a concert and you lose your voice. You can have hemorrhage of the vocal folds. So there are various things to say what can be causing phonotrauma. Sometimes you may not notice anything, but it's the person's perception that says that something is not right, which is why I go from all of this on the spectrum. I go from the self-perceived to what I can see, but I'm a big relier on the self-perceived, because if the patient tells me something isn't right, and even if I don't see anything, it's my job to say, what can we do to make them better? I'm a strong believer to use voice exercises. I use voice exercises all the time. I'm constantly in my class when I teach. I go. It helps me with my voice, and I do that in clinic as well with my patients for them to see that these are exercises that are going to benefit. So for a professional voice user, instead of waiting until we see a big change in the symptom on the vocal folds, I think educating them prior and saying how about we take steps to prevent it might be much more impactful for those individuals.
Because recently I was diagnosed with same thing, voice abuse and overuse, about just a month back. And
uh,
because my job was continuous, I'm IT professional, so other than talking, I had nothing else. So my only job was to talking for about long hours, and I
right.
did not even realize that something was happening. So it happened 6 months back, and after in between 2 weeks continuously, my voice was actually very dropped, so I couldn't
Mm-hmm.
speak. So I took it as maybe one of the case. So I just ignored it. And then maybe after 6 months, I started feeling that burning sense at the
Mm-hmm.
evening
Yeah.
time. Morning, nothing, but the evening, as I'm nearing to the evenings, I start something like a burning. So that's
Yes.
why again I approached. So I went to two ENTs to ensure that is there anything. They said that they have something called vocal nodule, early vocal nodule. So
Okay.
something they
Okay.
identified and they say because of you over abuse. I was not knowing that I was really talking that much or really abusive because it was a
Mm-hmm.
normal thing. So the advice was given: don't speak much now. For office anyway, you have to speak. There is no other way. Other than
Right.
that, talking to on the relatives, friends, all those things you stop, and social activities, all those things, so that you can reduce a bit. And some exercise has been given and some medication of pain killing. So because I
Right.
was not sure that whether it was really because of talking. I might also not knowing that it took some time, 6 months, and because of Corona pandemic, I did not go out for checking it. And recently, I did that laryngoscopy, and
Yes.
that they found out this is what it is. So
I mean, your vocal quality right now doesn't sound like one that has something sitting on their vocal folds. I mean, I'm not hearing a lot of that roughness or breathiness. So maybe it is healing, but do the exercises, especially
okay,
given that you have your demands in your voice. Like before you take a phone call, we're all that. You're in IT, which means you're using your voice a lot. Do blow bubbles or do this exercise even for 2 minutes before you go between calls. Try to do it. All you're trying to do is you are offsetting the impact that your voice has done to the vocal folds, and then by doing these exercises you are just encouraging your vocal folds to start its repair process. Really, like I mean, almost, I love Dr. Guzman's way he says that these exercises almost are like a massage to your vocal folds. It has this massage sensation. And that burning, that's very, very common, that I've had my singers indicate too. So I wouldn't go on complete voice rest, but I would, yeah, taking those vocal naps. If you don't have to talk, try to not talk, do these vocal exercises, and you will realize that it actually makes a big difference in the way your symptoms feel.
yeah, that's true. Because after a month, I'm seeing that burning sensation. It comes at least once in a week, but earlier it used to daily. It used to come after taking
Right,
this.
every day. Yes.
But
I had a
exercise
very,
two
sorry.
two times is a must, or every 1 hour exercise is a must.
How many these exercises, if you do it the right way, Mr. Pai, you can do it how many ever times you want. I'm doing it all. Like I'll probably be walking on my hall in the hallway, and I'll be doing these exercise. I'll be sitting here and I'll be, working on something. I'll be going. It's really like it almost has become part of me,
Okay.
that I'm constantly doing these exercises. The best way to actually start your day in the shower is to do these exercises, especially the and the, because we have a lot of mucus when we wake up in the morning. And these
Okay.
exercises will help clear that mucus without having to clear our throat. Clearing our throat is really something that we all need to avoid. It's not um, it's not a healthy way for our voice, because
Okay.
it does this. So here are your vocal folds, right? And your vocal folds kind of touch like this. For men it touches the entire way. For women it's only 3/4 of the way. They come together. When you clear your throat, this part goes in contact, and that
Okay.
is the maximum touch for phonation, talking as well. So if you're constantly hitting that, it's like this, right? If you keep clapping your hands like this, you're going to hurt your hands. Same thing happens to your vocal folds. You can hurt and develop those callus or lesions on your vocal folds. So it's important to really think about our voice use. We all take, how Joylyn initially said, she introduced saying we all take our voice for granted. That's what we do unless we start experiencing any kind of issues with it. So being aware and really being mindful of it, and us speech language pathologists like us, if we can spread the word on things that we can do, simple things we can do to take care of our voice, I think that's the biggest gift for World Voice Day, or that's the biggest awareness we can spread today on World Voice Day.
Thank you so much, Doctor. I think it was really informative. More than that, it was just in time. Friend actually forwarded me this, and right now when I'm going through, I think I got a reconfirmation and kind of confidence, so that it can always reversible kind of stuff.
Yes,
so,
it is. It is. So just work on those, and I've shared my email, so you can contact me anytime if you need any further information.
Sure. Thank you so much, and thanks for the management as well as who organized this. Yeah.
One of the questions on the chat was on long-term healing, like chakra meditation or chanting. We do chanting as part of our therapy, especially with resonant voice. That's a big part of chanting. So we go, my mom made me mad. So we do chanting as part of it, and we go low, we go high. But we really, my advisor, Kitty Verdolini, is actually trying to do a study on meditation for voice. So hopefully we'll get more information on that as the research comes out.
Yes, she has even put a point on meditation as well, because it helps us increase the oxygen intake. So that's also very.
Yeah, no reason. There's a reason why our ancestors have been chanting Om for a long time, right? So I use sometimes when my patients have difficulty with the resonant voice, let's go Om. So I use a lot of the Om to get that resonance forward as well.
Any more questions? Thank you very much, Dr. Chaya. It was a really wonderful session, and I'm sure everyone have benefited from it one or the other way. And we would like to do more on it, more research on it. So we'll get back to you for the same.
Yes. Thank you so much. This was a pleasure. I appreciate everybody's patience. Technology cooperated today, so all's good.
Yes. Thank you. Thank you, everyone.
Thank you so much, ma'am.
Thank you.
Her email has been put in the chat box. They're asking for the presentation.
I can send it to you, and if you want to share, I'll be. That is okay. I can send you a PDF of my presentation.
Okay. Okay. Thank you. And there's a recording been made, so we can share that as well.
Right. Thank you, everybody. I appreciate it. I'm going to sign off if that's okay.
Yes, ma'am. Thank you so much.
Thank you. Bye.
Bye. Good night.